Hello, friends. So we are on the 10th case in this series. A young girl is taken to the doctor with a nasty rash on her torso and neck that has extended to her arms. Her axilla is the most damaged area of her body, yet her palms and soles remain unaffected so far. Her parents claim that she has been sick with a fever and a sore throat, and her serum you have ordered for ASO test, which has come positive. She is given penicillin. Her rash fades after a few days, and her palms and soles show signs of discoloration. So, what is this? This is a classical case of scarlet fever, and the causative agent of is the scarlet fever is Streptococcus pyogenes. Now, as we are discussing the pediatric patient with a rash. We should also see the five most common pediatric diseases with the rash. First is measles, second is rubella, third is scarlet fever itself, fourth is roseola, which is caused by human herpes virus 6, and erythema infectiosum, which is caused by parvovirus B19. Now, what is the pathogenesis? How Streptococcus pyogenes causes this scarlet fever? What are the other features? How we should investigate it, and what is the treatment? So pathogenesis, usually we know that Streptococcus pyogenes is the most common cause of sore throat or acute bacterial pharyngitis. Now, this bacteria, they release pyrogenic exotoxin, which induces usually fever, that is A, B, and C. And this toxin, they enter into systemic circulation, and that is the reason it causes this fever. It causes this sandpaper-like rash, which usually starts on trunk and then spreads outward. So it starts in center and then spreads to the periphery. It also shows a strawberry tongue within first 2 days. And as the rash subsides, it starts to show discoloration of palm and so. Now, which investigation you should do? A ESO test, that is anti-streptolysin O test, which is indicative of evidence of streptococcus infection, which detects antibody against the toxin streptolysin O. And the treatment is penicillin.